Dr. Alexis at AZ Dance Med. I'm just going to take a couple minutes to talk to you guys about rolling. All right. So if you've come to any of my presentations or seen any of my other posts, you know that I love rolling, especially as an alternative to stretching. It's a little less daunting on the tissues. You can sit into them a little bit easier, so they're a little less aggressive in terms of pain or discomfort. So I'm just going to show a couple of my favorite ways to roll and hope you guys, take some tips and get to roll and help out your flexibility. So as you can see, I've got like different examples of balls that I like to use. They are more based on the size of the area that you want to roll. Okay, they're also a little bit based on the size that you actually are. So my little like 6 or 7 year olds that every once in a while just have like a little tight space, sometimes I use these smaller ones to get into, a smaller quad or a smaller hamstring. My adult sizes, tennis ball, my actual favorite is this nice little dense lacrosse ball. So there you go in a nutshell. You got lots of different choices. So let's get to it. First I'm going to start with hamstrings because that's what everybody wants help with. Basically, let's see if I can get a good result. Let's see here. If I sit this way, you want to kind of do like a pre-test so that you can see if your rolling is actually going to be effective for you. So I'm just going to do just a gentle forward reach and note where I feel resistance. So for me, reaching in this direction, I feel some tension, most of my tension on my left hamstring, kind of in the middle portion. So that's where I'm going to roll. I'm going to use my lacrosse ball, my favorite, and I'm just going to sit it under that left side and just kind of work it back and forth. Again, the rest of my body for the most part is nice and relaxed. I don't have to, hold my body weight up or anything like that. I can just chill and gently move it back and forth. People want to ask me how long, 30, 45 seconds, something like that. Sometimes rolling can be very ticklish. So if that's you, you can also just do like a sustained pressure in that area, the area where you felt the tightness when you reached forward. You can also do a standing reach in forward, like touching your toes basically, and see where you feel your tension then as well. So hopefully that's about 30 seconds or so. I can remove it, and then I can just reach forward again and see, 1, if it helped the area that I originally felt the tension, and 2, does it reveal another area that I may want to roll out? And yes, it definitely helped. And now my tension is a little bit more in my calf area. So kind of like right in this area on both sides, but now I can show you the side that's closest to you guys. So calf area, same thing. And actually my calves are smaller than my hamstrings, so I'm actually going to switch balls. Calf area, same thing. The rest of my body is nice and relaxed. I shouldn't have to hold my breath, hold my body weight. I shouldn't be trembling or shaking, no sweating. This should be very low key and very tolerable for the most part. And there's my spot. Oh. So yeah, I'm just gonna hold it here for a second. Just for a second. And then I can go back to rolling. Again, you do not have to roll your entire body, so you don't have to make it one of these things. You're not pizza dough, okay? Just go back and forth very gently with that one part of your body. Same thing, since I said I felt tension on both sides, I'm gonna do a little bit of my other side. And it's actually my outer aspects of both of my calves where I felt the tension. So I'm rolling. You can see I'm a little bit rotated. I'm on the outer side of my calves. Okay. Yeah, Dr. Alexis probably needs to do this a little bit more. But, okay, let's see how we feel. Yeah, definitely much better. Less in the calves. And now it's moved to another spot. But I think you get the picture. You can keep working in your forward reach to feel where your next area of restriction is, and just take 30 seconds or so to release that area. Once you've kind of gotten to where you want to be in terms of your mobility, it's just a matter of just keeping that mobility. So you might want to work with some nice like dynamic glides or stretches of your choice just to maintain what you gained from the rolling. Okay, I want to move on to glutes. A lot of times, some tension in our glutes holds back our rotation or our turnout. And let's be honest, who is not trying to improve their turnout on a constant basis? I know I am. I think glute size, and your glutes can be very ticklish and tender. So I'm gonna go with this racquetball. It's a little bit softer. You might be able to see that I can squeeze it a little bit versus like the lacrosse ball that I can't squeeze. Squeezing, can't squeeze. So this actually might be a little bit more tolerable. Same thing, I can gently just work it back and forth. Find your spots of restriction, 3 T's, find your tickle, tender, or your tight spot, and just let it release. Again, 30 to 45 seconds or so, and just let it relax there until the zinging, the tight, the ticklish, or the tenderness just kind of resolves itself a little. Hey everybody, this is Dr. Alexis with AZ Dance Medicine Specialist. Just wanted to remind you to keep in touch with us on our social media. Instagram at AZDanceMed. You can follow us on Twitter at AZDanceMed. You can subscribe to our YouTube channel, and then of course, we're on Facebook as well, AZ Dance Med.